Hello friends, welcome to our channel. Today we will explore 10 warning signs of heat stroke. Heat stroke is a severe and potentially life-threatening condition that occurs when the body's core temperature rises to dangerous levels due to prolonged exposure to high temperatures and humidity. This medical emergency demands immediate attention as it can lead to organ damage and even death if not treated promptly. Recognizing the warning signs of heat stroke is crucial for preventing its dire consequences. In this comprehensive guide, we will discuss the 10 critical warning signs of heat stroke, its causes, risk factors, and strategies for prevention. High body temperature. One of the most obvious signs of heat stroke is a markedly elevated body temperature. In a heat stroke, the core body temperature can rise above 104 degrees Fahrenheit, 40 degrees Celsius. This extreme elevation in temperature is a result of the body's inability to regulate heat effectively. It can lead to a cascade of physiological responses, impacting various organ systems. Rapid heartbeat. Heat stroke often causes a rapid heartbeat or tachycardia. As the body overheats, the heart tries to pump blood faster to help dissipate heat. This increased heart rate can lead to palpitations and may be accompanied by dizziness or lightheadedness. Rapid breathing. Heat stroke can also cause rapid and shallow breathing, known as tachypnea. The body attempts to cool itself through the evaporation of sweat, which requires increased respiratory effort. This rapid breathing can result in hyperventilation and a feeling of breathlessness. Profuse sweating or lack of sweating. While excessive sweating is a common symptom of heat exhaustion, a precursor to heat stroke, in some cases of heat stroke, the body may stop sweating altogether. This is particularly concerning because sweating is one of the body's primary mechanisms for cooling down. The absence of sweating can lead to a rapid rise in body temperature. Altered mental state. Heat stroke can cause confusion, agitation, irritability, and even hallucinations. The overheating of the brain can impair cognitive function and lead to behavioral changes. Victims may appear disoriented, and their speech may become slurred. Nausea and vomiting. Nausea and vomiting are common symptoms of heat stroke. As the body struggles to maintain its core temperature, it diverts blood away from the digestive system, leading to gastrointestinal disturbances. These symptoms can contribute to dehydration and electrolyte imbalances, further worsening the condition. Headache. A severe and throbbing headache is another warning sign of heat stroke. This headache often accompanies other neurological symptoms and is a result of the brain's response to elevated temperatures and dehydration. Red, hot, and dry skin. A classic sign of heat stroke is hot, dry, and flushed skin. While it may seem counterintuitive because heat stroke is associated with overheating, the body's cooling mechanisms have failed at this point. The blood vessels have constricted, preventing proper blood flow to the skin, and sweat production has ceased, leaving the skin dry to the touch. Muscle cramps and weakness. Muscle cramps and weakness are often experienced by individuals suffering from heat stroke. The loss of fluids and electrolytes through sweating can lead to muscle spasms and a feeling of physical weakness. Seizures and loss of consciousness. In severe cases, heat stroke can progress to seizures or loss of consciousness. When the brain becomes severely overheated, it can malfunction, leading to convulsions or complete loss of consciousness. This is a medical emergency and requires immediate intervention. Causes of heat stroke. Understanding the causes of heat stroke is crucial for prevention. The primary cause is prolonged exposure to high temperatures, especially when coupled with high humidity. Other contributing factors include dehydration. Inadequate fluid intake or excessive fluid lost through sweating can lead to dehydration, making the body more susceptible to heat stroke. Physical exertion. Engaging in strenuous physical activities in hot weather without proper hydration and cooling measures increases the risk of heat stroke. Chronic illnesses. Certain medical conditions, such as heart disease, respiratory disorders, and obesity, can reduce the body's ability to regulate temperature and increase susceptibility to heat stroke. Medications. Some medications, including diuretics, beta blockers, and antipsychotic drugs, can interfere with the body's ability to regulate temperature. Age. Infants, young children, and the elderly are more vulnerable to heat stroke because their bodies may not regulate temperature as effectively as those of adults. Alcohol and drug use. Alcohol and drug use can impair judgment and the body's ability to regulate temperature, making individuals more susceptible to heat-related illnesses. Risk factors for heat stroke. Several risk factors increase the likelihood of experiencing heat stroke. Climate. Living in or traveling to regions with hot, humid climates increases the risk of heat-related illnesses. Lack of acclimatization. Sudden exposure to high temperatures without time for the body to acclimate can be dangerous. Poor hydration. Inadequate fluid intake or pre-existing dehydration can predispose individuals to heat stroke. Overexertion. Engaging in vigorous physical activity, especially during the hottest parts of the day, without adequate rest and hydration can be risky. Obesity. Excess body fat can impair the body's ability to cool itself, increasing susceptibility to heat-related illnesses. Medical conditions. Certain medical conditions, such as diabetes, heart disease, and autoimmune disorders, can increase the risk of heat stroke. Medications. Taking medications that affect temperature regulation can elevate the risk. Preventing heat stroke. Preventing heat stroke is crucial, especially during the sweltering summer months or in high-temperature environments. Here are some essential strategies for prevention. Stay hydrated. Drink plenty of water throughout the day, even if you don't feel thirsty. Avoid alcohol and caffeine, which can contribute to dehydration. Wear appropriate clothing. Opt for lightweight, loose-fitting, and light-colored clothing that allows sweat to evaporate and helps keep your body cool. Stay cool. Seek shade, use fans or air conditioning, and take cool showers or baths to lower your body temperature. Limit physical activity. Avoid strenuous exercise during the hottest parts of the day. If you must engage in physical activity, do so in the cooler morning or evening hours. Take breaks. If working outdoors or participating in sports, take regular breaks in a cool, shaded area to rest and hydrate. Use sunscreen. Apply sunscreen with a high SPF to protect your skin from the sun's harmful UV rays. Be mindful of medications. If you are taking medications that affect temperature regulation, consult your healthcare provider about appropriate precautions in hot weather. Check on vulnerable individuals. Keep an eye on infants, the elderly, and individuals with chronic illnesses, as they are more susceptible to heat-related illnesses. Conclusion: heat stroke is a severe and potentially life-threatening condition that requires immediate attention. Recognizing the warning signs and risk factors is essential for prevention and early intervention. By staying hydrated, staying cool, and taking precautions in hot weather, you can reduce your risk of heat stroke and enjoy the summer months safely. It is crucial to educate yourself and those around you about the importance of heat stroke awareness and prevention to ensure everyone's well-being during periods of extreme heat. Thank you for watching this video. Don't forget to like and subscribe our channel and press the bell icon for more informative videos.